So the topic given to me today is dynamic in healthcare management. So before I proceed, I want to make some disclaimer. The views and opinions expressed in these presentations are those of mine and do not necessarily represent the official policy or positions. And there's no animals were harmed during the making of these PowerPoint presentations. My name is Dr. Lu Chi Woons. I'm your guide for this dynamic in healthcare management during the COVID-19 pandemics. Follow me and ponder the questions. Why the management is so important? Well, a single wrong management can branch out into infinite realities. Remember the year March 2020? This COVID-19 pandemic totally changed the way we live, the way we work, and the way how we socialize. The changes are dynamic, fluid, evolving, and very much still ongoing. And what I said today might not be relevant tomorrow and need to be revised. Well, this COVID-19 pandemic has dramatically changed the nature on our social interactions. It has totally killed this handshaking and the hugging. So as an alternative to the handshakes and hugs and high five, what we have is we are doing this like waving, putting hand on the heart, this is commoners, and this is the highbrow and the all good nods. If you are creative enough, you can do this like Star Trek hand sign, live long and prosper. Well, what are the changes in our airline company? Well, gone are the days where you can see the flight attendant wearing a fancy uniform like this, okay? Every time now you're boarding a plane, you're like entering an ICU. And what are the changes in our governments? Well, we are witnessing changes of 3 prime ministers in these 3 years during the COVID pandemics, okay? Our latest new prime minister, Dr. Sri Ismail Sabri, has invited the political oppositions to be part of the government's special committees, tasked with fighting the COVID-19 crisis together. They also ramp up the COVID-19 vaccinations and try to spur the economic recovery. Well, if you look at the granular data provided by our Ministry of Health of Malaysia, well, this is the month of September, just like 1 month ago, like less than 30 days ago. You can see that every day we have about 300 to 400 COVID deaths. To put that into perspective, well, I can see as a data here, our 737 can carry about 180 passengers. Well, our daily death toll in Malaysia in the month of September is like having like 1 to 2 aeroplane crash every day. Well, to tide over the crisis, our government has announced the fully COVID-19 hospital. Okay, we start with the hospital Sungai Buloh, then have the hospital Angtang, then we have the hospital Selayang, and the hospital Sedang, and latest into our addition is hospital Sungai Siput to deal with the increased number of the COVID patients. Well, the outpatient services and the specialist clinic at the COVID-19 hospital would be referred out to the nearest health facilities. But the clinical services for methadone, chest, hemodialysis, and forensics will operate as usual. And how to create space? It's all about restructuring and repurposing the space and the bed usage. It's all about how we utilize the human resources differently. Well, we have this daycare, day surgery units. We put up these partitions, we install the monitors to create more ICU beds. And we also convert the double room to triple room and so on. And as you can see here, we have the GHKL pediatric wards that's turned into the COVID-19 treatment facility. So it was co-managed by our pediatricians and the infectious disease physicians. This is the maternity hospital in GHKL, and it was repurposed into the COVID wards as well. So basically, any room with oxygen pods, it can be repurposed into the COVID wards. What you need is just the oxygen tanks and the oxygen concentrators. For the oxygen tanks, you need to refill as more flammable. Initial running cost is a bit lower, but you need to pay for the long-term payment for refilling. It comes in a various size. Well, this smaller size is ideal. Whereas for the oxygen concentrators, it's an infinite source of oxygen. It's like very much safer compared to the oxygen tanks. You just need to pay the monthly payment for electricity bill, and it's very suitable for our home use. Well, at our emergency departments, okay, this is the holding area, okay, and we are able to create the 30 to 50. We are able to free up 30 to 50 of this lower of this bed for the low risk COVID patients, okay, and make rooms for the more acute patients. And this is our asthma room. Well, asthma room is equipped with this oxygen pods, and it can be easily repurposed into the COVID-19 wards. And we also built the tent outside the ED for rapid evaluation of the lower risk COVID patients. And this helped to keep the ED for the higher risk patient as well. Regarding staffing, our health ministry also recall the retired doctors, nurses to join our front lines. All hands on deck. We also expand the responsibilities. So we took in the healthcare workers from the radiology units, pathology unit, ophthalmology departments, and ENT departments. Well, they work together in expanded capacities with a physician and infectious disease leadership oversight. Well, thankfully, we also received support from this private hospital and also field hospital to reduce the patient congestions. Our field hospital is actually a temporary hospital set up near a battlefield to provide emergency care, but now it has been repurposed to take care of the COVID-19 patients. Well, health ministry also called for the volunteers to help COVID-19. For the volunteers, their scope of duties including taking temperature, screening the symptoms at the healthcare facilities, and also international entry points, and also at the quarantine stations. Whereas the volunteers with a medical background, they can help to treat the patients and conduct this what we call the contact tracing, as well as doing the swab tests. Our volunteers also escort patients in the ambulance. They also work in the mortuary. They're also involved in the environmental hygiene, linen management, and they also cook for us. Yes, they do. Now, this is a fun fact to know that Google company, every year, they spend about 72 million for the free foods, free employee foods. Well, thankfully, during the MCO1, our parent government also provide free on-call food every day without fail for the healthcare workers. So the healthcare workers do not have to worry about the food, even during the late night or early morning. Well, we document patients' medical record digitally nowadays using these electronic medical records. Well, all what we need to do is we have to do this bed mapping. If there's a new ward and additional bed added, we have to let the computer knows by doing the bed mapping. Well, let's understand how the COVID-19 is transmitted. Well, we have this what we call the direct contacts, indirect contacts, transmitted through droplets and through the airborne. Well, to transmit an infections, there must be three elements, okay? Well, the first element, there must be a pathogens, the COVID-19 virus, a environment that facilitates the transmissions, and a human host that is susceptible. So our aim is to break the chains between the COVID-19 virus and the host, human host. So how are we going to do that? We wear the face mask, we perform good hand hygiene, and to break the chain between the environment and the host, we avoid the crowded places, we do this physical distancing, we stay at home, we isolate ourselves. So to break the chain between the environment and the COVID-19, we improve our sanitations, we disinfect the high-risk area based on the risk assessments. Well, every time when we cough or when we sneeze, we can spread the droplets of the saliva and the mucus which contains the COVID-19 virus. Once the virus is suspended in the air, we call that airborne. They become airborne, okay? The virus can stay longer and travel further. So to put that into perspective, the size of the COVID-19 virus is about 200 size smaller than our hair. Okay, this is a comparison side by side. Okay, this is the COVID-19 virus. This is our hair. And we also know that the commonest COVID-19 outbreak area is number 1, our pantry. Number 2, the changing room. Number 3 is our prayer room. And lastly is in the wards. So how do we overcome that? In the pantry, we limit 1 to 2% at a time, maximum 15 minutes per person. And for the changing room and prayer room, we will mandate to wear the minimum 3-ply mask at all the time. For the wards, we will ask them to wear the minimum 3-ply mask and wear this face shield. This is a face shield. And when treating the COVID-19 patients, we follow this CDC guideline. These are contact precautions, the proper precautions, the airborne precautions. And we don't allow visitors to come in, okay? For all the staff with the contact and the proper precautions, before entering the room, we ask them to perform the hand hygiene. And we do this donning. We put on this gown or aprons. We put on the surgical mask. We also put on the protective eyewear. We perform hand hygiene. We put on the glove. Upon leaving the room, we also dispose the glove. We dispose the gown or aprons. We do this hand hygiene, remove the protective eyewear, and we dispose the mask. And lastly, again, we wash hand again. Well, for the airborne precautions, basically everything is the same, except that we don't use the surgical mask. We use this N95 mask instead. Well, this is strict hand hygiene before entering and exiting the patient's room. And all the patients need to be tagged using this wristband for easy identifications. Medical records, bedside area also tagged as per protocol. And every healthcare workers will be provided this personal protective equipment. Ideally, it's one equipment for one patient. That's what we call dedicated medical equipment for each room or per patient. Well, we also place the patients at least 1 meter apart. We have to handle the pandemics with sensitivity. We don't do this of a sneeze prank, okay? We also place the visual alerts at the entrance of the healthcare facilities, instruct the persons with respiratory symptoms to practice this hand hygiene, okay? And also the cough ethics. Well, we also make these hand hygiene resources, sanitizer, tissue and mask available at all common areas at all time. Well, at the point of entry, the triage area, by using these visual aids, okay, we ask about the symptoms, the body aches, any loss of smell, fatigueness, running nose, shortness of breath, headaches, sore throats, sneeze, fever, diarrhea, chills and rigors, dry cough. We also ask about this proper traveling history, okay? And those with fever and those with shortness of breath may be fast-tracked first. Well, at the triage area, everyone is mandated to wear a surgical mask at all times. And we also separate the patients in a dedicated waiting area. There must be a social distancing 1 to 2 meters between patients in the waiting room. And the room must be well ventilated. As you can see, the windows are open, doors are open. Now, at the triage area also, we also provide tissues, surgical masks. We provide the resources for performing the hand hygiene. Yes, we give this alcohol-based hand rub. And we also provide these no-touch bins or biohazard bag for disposal of tissues or surgical masks. Or the surgical mask, yes, okay. So at the point of entry, the triage and the waiting area, we frequently clean the high-touch area after patient left the area. We clean the chair, we clean the table, we also clean the couch, okay? And every time when the spillage or soiling, we also clean. For the patient placements, well, those with a suspected COVID cases, while waiting for the result, they can be placed in the single isolation room. Well, this is our single isolation room. This is with a attached bathroom. Even a single room without a bathroom is actually acceptable. Okay. After knowing the result if COVID positive, actually we can cohort the patients together. Cohorting the patients with COVID-19 infection is actually allowed. And as mentioned earlier, one equipment for one patient's dedicated use of patient care equipments. If unavoidable, then we clean and disinfect them between use or after use. Speed manometer, this is the stethoscope, this is the digital thermometer, this is our commodes. And we're not talking about this aerosol-generating procedures, AGP. What is AGP? It's a medical procedure that can result in the release of airborne particles, which is the aerosols that might contain the COVID-19 virus. Well, the examples of the AGP, the aerosol-generating procedures are the intubations, tracheostomy, ambulatory packing during the CPR, airway suctioning, bronchoscopy, and the nebulization for the asthma patients. Well, this procedure is best done in a negative pressure room, okay? So what is negative pressure room? And you can see the direction of the flow, okay? You can see that the piece of paper is sucked from the corridors into the room. So there's actually what you call the exhaust fan mounted in the on the ceilings, okay? It sucks all the air from outside to inside. Regarding the transportation of the patients, we try to avoid movements unless medically very necessary. If the movement ever is required, we use the pre-planned routes to minimize the exposure to the other staff, patients, or to the visitors. And before we move the patients, we also notify the receiving ends before sending the patients. Regarding the specimen collections and the transport of the specimens, well, we do all sorts of samplings, okay? We do the nasal swab, we do this sputum collections, we do this saliva collections, we do this oral pharyngeal swab, and we also do this nasal pharyngeal swab. One thing that our Malaysia we don't do is we don't do this anal corner COVID swab, okay? And all the specimens should be regarded as potentially infectious. We send using this the leak-proof specimen bags like these ones. And these specimens are delivered by hands, okay? And we do not use this pneumatic tube system to deliver the specimens. Well, disinfection and sterilization the wards, okay? And we always clean and disinfect the surfaces that are likely to be contaminated, like the bed rails, the tables, and also these door knobs and the toilets, okay? We are doing that at least once a day, or more frequently if it's visibly soiled. And for the reused equipment in the ICU, we actually wipe the external surfaces of a large portable equipment. For this one, for example, our portable X-ray machines and our ultrasound machines. And we also wipe the ICU equipments, okay? Now, what do we use? We wipe using this 70% alcohol, okay? And this sodium hypochlorite, okay? We wipe after every use or in between use. Well, according to the Rutula and Weber 2019 to the study, okay, and also the study of the Chin et al. 2020, how long does coronavirus last on the surfaces? Well, in the air, it lasts for about 3 hours. Plastic can last for 3 days. For the cardboard, it lasts about 3 to 5 hours. In the steel, it lasts for 2 to 3 days. Copper lasts for 4 hours. In the glass, it lasts for 4 days. In the wood, it lasts for 2 days. And lastly, in the metal, it lasts the longest, about 5 days. Now we are talking about the terminal cleaning of an isolation room, okay? And what do we mean by terminal cleaning? Every time we discharge or we transfer a patient, okay, we do this thorough cleaning, okay, disinfections, and also use this UV lights, ultraviolet germicidal irradiations on all the surfaces, including the floors and reusable equipments. Okay, in other countries, this is also called the discharge cleaning. Well, regarding the dishes and the eating utensils, okay, we try to use as much as possible the disposable one, okay. And for the linen management, we wash the patient clothes, towels, and the bed linen separately. If possible, we wear the heavy-duty glove, okay, before we handle the patients, okay, before we handle the linens. And we never carry the soil bed linens against the body, okay. Okay. And we wash and disinfect the linen using the washing machine at the temperature of 60 to 90 Celsius with a laundry detergent. And after the process is done, do not forget to wash your hands at the ends, okay? All these contaminated linen should be handled as little as possible, as gentle as possible, to prevent the contamination in the air. Washing or disinfecting the linen should be handled according to hospital protocol. Regarding the healthcare workers, okay? Well, our healthcare workers, if they're having this high-risk condition, having this heart disease, okay, having this other comorbids, okay, or if they're immunocompromised, they shouldn't be allowed to manage or provide care, okay, for the COVID-19 patients. And we also have to ensure the healthcare workers, their vaccination schedules are up to date, okay? If any of the healthcare workers become symptomatic, he or she need to report the supervisor in the team and manage accordingly. Regarding the visitors management, usually we don't allow visitors. If really got no choice, okay, we restrict the visits to the high-risk patients only. We don't allow them to visit the elderly or any patient with comorbids. Well, as a summary, well, always make sure that you wear the face mask at the workplace all the time. And we wear the face mask and the face shield if attending to any patient in the clinic. And also please wear the N95 and face shield if we are performing this aerosol generating procedure, okay? And all the time we have to adhere to our SOP, observe physical distancing, practice hand hygiene, always avoid a crowded area. Do inform immediately if you're having close contact to any confirmed positive COVID cases, or if you develop symptoms, having sore throats, having symptoms. Okay. And regarding the building management, okay, we are mostly focused on the ventilations. Last time we focused on the surface decontaminations, but the latest data suggests that our COVID-19 virus primarily spread by the airborne mechanisms, especially indoors. And in indoors, the virus can stay as airborne for 2-3 hours. So in indoor, if you practice a social distancing for 1-2 meters, actually it's very little meaning, okay, unless you improve your ventilations. And how to reduce the indoor airborne transmissions? We open the doors, okay, we open the windows to bring in the fresh air. We also install the windows-mounted exhaust fans or put a stand fan at the windows to suck up the air from the room. We can also install the aircon with the HEPA filter to stop the recirculation of the air. And also, we can always keep the toilet exhaust fans on all the time. Additionally to that, we can also install a carbon dioxide monitor as a proxy indicator. The rationale is if there's a fresh air coming in, the level of the carbon dioxide should drop, okay? So how do we reduce the viral particles in the air? We can always install a portable air cleaner with the HEPA filter like the one in the hallway. And how to sterilize the air? We use the ultraviolet germicidal irradiations. That's all for my presentations. If you have any questions, you can ask here.